Thank you, Mr. Speaker, and thank you, Representative McEwen, for first bringing this bill to us, highlighting some of the issues, and starting this process that has resulted in this bicameral, bipartisan, really omnibus bill on long-term care. I'm very proud to have been a part of this, and Representative McEwen's job was to give you the context of why we worked on this. My job is to tell you a little bit about what is in the bill, and part of it I'm going to read from the floor letter that Vice Chair of the Human Services and Housing Committee, Representative Olson, has placed on your desks. So House Bill 3359 is a comprehensive reform bill that raises staff training requirements, establishes new quality measures for residential care and assisted living providers, including memory care, enhances the state's oversight authority, and establishes a progressive disciplinary system, including higher penalties for rule violations and abuse. Highlights of the legislation include the following. 1, increased staff training and competency. All direct caregivers must receive training in nationally recognized dementia care best practices before caring for residents, and DHS will develop rules for how they must demonstrate competency of the material. All caregivers must complete 6 hours of continuing education each year, and the department must develop a staff acuity tool to make sure that there's sufficient staffing to take care of the needs of the residents. 2 are quality measures on key outcomes. Residential care and assisted living providers must track and report key quality measures. Results will be posted online by DHS, so they will be transparent, and compiled in an annual report available to the public, providers, and policymakers who can use the data to monitor trends and determine how Oregon's long-term care system is performing over time. 3, enhanced oversight and supervision will focus on the chronically underperforming facilities. As Representative McEwen said, many of them are doing a great job on there, and we want to make sure that the department spends its time with more frequent surveys by the state to make sure a provider comes under compliance. 4, safe prescription drug packaging, to make sure that we're giving the right dosage and medication to people. This will ensure that prescription drugs are packaged in unit dose packaging, such as blister packs, to promote safe drug administration. 5, progressive enforcement, conditions on licensure and increased penalties. It establishes a progressive enforcement system. Penalties and conditions on licensure are designed to remediate problems. It includes scope and severity criteria for assessing higher penalties for rule violations and abuse. The restrictions on admissions is still left to DHS's discretion, but is intended to be used after other tools have been used, and really in serious cases where there is still a concern for the safety of residents. And lastly, if there is an immediate threat to the safety of residents, it streamlines the department's authority to impose an immediate license suspensions. This is a really big piece of work by many, many different stakeholders. I know that Representative McEwen has mentioned many of them. We had very passionate testimony. Big step forward. We've got several items in the parking lot that we will continue to consider in the future, but I urge your aye vote.